So I've been pretty critical of the movie A Beautiful Mind, but I have to say one good thing. One of the many few good things in it is there's a scene where John Nash's wife is trying to get intimate with him, but he just doesn't feel it, and she asks, "Is it the medication?" And she gets really frustrated, breaks a mirror. So it pretty much just says really that the medication does unfortunately affect you. The reality of being on the medication is you are pretty much stuck on medication for the rest of your life. It's very expensive. If you don't have coverage, you're paying like right now I'm paying 450 every 3 months for medication. Um, I don't have coverage yet. Hopefully, sometime I will get coverage because it's just that most places don't cover the main one, which is the antipsychotic. So, all the same, like you will have loss of libido, sexual libido. Like it's virtually gone for me. Like I virtually have none of it. Um, Sometimes you feel a little bit more apathetic, and that's actually known as flat affect. Like your face has like no expression. Um, Another thing that you may encounter is sort of like it's called tardive dyskinesia. It's a pseudoparkinson syndrome. So when you're walking, your arms are kind of like just flailing off the sides, like you don't even recognize the way they're moving. You feel as though you can't even tell they're moving. They're like, generally speaking, when people walk, it's just involuntary. They sometimes you have to actually consciously sort of move them so that they're not like looking as though you're flapping your arms. Uh, I there you medication, almost every single kind of schizophrenia medication causes you to gain weight. Like, I mean, mine does, but I mean, I know one thing. I would be a lot lighter if I sort of like gave a little bit uh, more into like eating healthy and stuff right now. Like just because of the whole COVID situation and the fact that gyms are closed, I'm not really paying too much attention. But absolutely, I will. Eventually try to get fit again. It's about time. I should get fit, but it's just right now. It's just my care for that is gone, and it's another thing that medication can do. It takes away your motivation often. Like often you have absolutely no motivation whatsoever to do anything. So, but I know I will eventually get enough motivation to do something about my weight because it has skyrocketed quite a bit. Um, you also have something called xerostomia, which is chronic dry mouth. Like your mouth is always dry. Like, I mean, I've just been chugging water. I know I also have that kidney problem that I've talked about before, but it's just your mouth is always dry with the medication. Um, so I think that I have like I'm not. There are other kinds of medication that cause even worse problems, like even like torticollis, where your neck's like kind of like a glutathione or wax flexibility, where say you move your arm upwards and it just stays up. It's like you don't even realize that it's not there because you have like absolutely no proprioception. But I don't suffer from those because I'm actually on a neuroleptic. But I just kind of wanted to make sort of a quick video that this is sort of the reality of being on medication. So anyway, as always, thanks for watching.